In this video, we're going to talk about making a differential diagnosis. And what that means is taking all the information from your history, from your physical, and anywhere else that you got data, and coming up with explanations that could let you know why those things are happening. That is, what disease processes could explain the patient's signs and symptoms. So there's lots of different ways for doing it, and that's what we're going to talk about in this next video. We are going to talk about this portion here, where we're going to learn how to make a differential diagnosis. And so you remember we had a patient before whose head was pounding. You decided that was a headache, and we had a bunch of diagnoses in our brain that we needed to pull out. So how do you know which diagnoses you need to consider for a particular chief complaint or a particular patient encounter? That's the process of forming a differential diagnosis. And if you remember from the first video, a differential diagnosis is a list of various potential causes or various potential diagnoses that could be the reason, that could explain the patient's presentation. And so there are a number of methods with which you can create this list of potential causes. And here are a bunch of them, and we are going to go through each one. Now, each one has its pluses and its minuses, its benefits and its problems. And so we'll take a look at some of these. So the first one is, what is most probable? And that's important because this is all about probability. And so we want to know about what is most probable. So in your office, you probably see headaches most often as the cause of headaches. Or migraines is the most often cause of headaches. So that would probably be the most probable thing. Now, you're going to miss uncommon causes if you only go with what is most probable. And what is most probable often depends on your past history, what you've seen before. So it's totally dependent on you. So we can't just go using that. All right, so here are some other common causes of headaches that you might see in the clinic. Now, the next one is, what can I not miss? So these are the emergent causes, or the killer diagnosis, or the can't miss or must not miss. So in the emergency department, you shouldn't miss bleeding in the head, carbon monoxide poisoning, or a brain infection, because a patient could rapidly deteriorate or even die from that. So you must not miss those. There are others in the list for headache, but for the sake of this video, I'm going to make it simple like that. And another method is to use mnemonics, and here's one called Vindicate that allows you to generate a list of potential diagnoses that could explain a patient's condition. And this one goes in an organ-based method, so vascular, inflammatory and infectious, neoplastic, degenerative, idiopathic, meaning not sure what causes it, congenital, autoimmune, traumatic, or endocrine. So for headache, here's some different potential things. A carotid dissection, which is a tear in the blood vessel. Temporal arteritis is inflammation of one of the blood vessels in the head. A brain tumor, neoplastic means cancer, so brain tumor. Idiopathic, we don't know what causes migraines. Congenital, maybe there's the patient was born with a condition that led to swelling in the brain called hydrocephalus. Autoimmune could be multiple sclerosis. Traumatic could be an epidural hemorrhage, and endocrine could be pituitary swelling. So all of those can be potential causes. So this is just a framework that you can use to try to come up with potential diagnoses. There are also lists of differential diagnoses that you could find online as well as in books, and you can see here's one, ddxof.com, and this is one for headache, and it kind of gives you a flow chart of potential things that you should worry about for headaches. You can see here central venous thrombosis, glaucoma, giant cell arteritis, carbon monoxide, trigeminal neuralgia, and there's a whole bunch of things in here. You can also pull lists out of books, and so this is a list for a differential diagnosis for headache, and you can see it is quite large. So can we make this list any smaller? Because this would be very challenging to work with. Of course you can, and that's why it's important to use those that medical terminology and semantic qualifiers in order to better characterize the headache. So not only is this headache a headache, it's an acute traumatic headache, meaning perhaps they hit their head. So these are the ones that we should worry about with an acute traumatic headache. Maybe it's an acute febrile headache, and these are the ones that I would worry about with an acute febrile headache, right? All right. There are other ways to come up with a differential diagnosis, and you can use anatomic frameworks. So what in the head can cause headache? So let's think about what's in the head. Well, there's the stuff covering the head, which is the muscle, skins, and bone, and there's the stuff inside, which is inside the skull, which is the brain, the meninges, the coverings of the brain, the blood vessels, and the venous drainage. And so each one of those can have something go wrong with it that could potentially cause a headache. So you might think also about chest pain. Well, what's in the chest? There's bones, there's muscles, there's the heart, there's the lungs, there's the esophagus, there's the breathing tubes, etc. Another method is to use physiologic frameworks, like how do headaches work, right? So headaches can happen from one of three different causes: increased pressure in the head, decreased nutrients, or various primary causes. And how would you get increased pressure? Well, you can have blocked outflow of the fluid in the brain, so you get a buildup of pressure on the inside because it can't get out. You could have bleeding in a closed space, so that causes increased pressure, or swelling of the brain itself. And here are some potential explanations for that. And you can see the same here. So you can think about how physiologically might a headache happen, right? And then the last one I want to mention is pattern recognition. And this is what the expert clinician will have, who has seen hundreds, maybe thousands of people with headache and can quickly recognize, oh, I recognized this constellation of symptoms and signs, and I know that this person is having a bleeding aneurysm because I've seen this many, many times before. So these are the different methods we have for coming up with a differential diagnosis. Most probable, what are the things you commonly see? Because common things are common, right? But you will miss uncommon things. Must not miss. We can't miss the things that are going to kill someone. But not everything is an emergency, right? Mnemonics and lists. And so these are oftentimes very big lists. So you need to somehow whittle that down to a more manageable amount. Anatomic and physiologic frameworks can also generate pretty exhaustive lists. So you need to get information that can quickly whittle that down. And pattern recognition, which with experience you will develop. And with a lot of the frameworks, they can be presented in this branching tree diagram that says, if the person has a history of headaches before, go down this side. If they don't have a history of headaches, go down this side. If there's a change in their symptoms, go down this way. If there's no change in their symptoms, go down this way. And that kind of helps you narrow down your approach and gives you a nice, well-defined approach. And so that's it for making differential diagnoses. Thank you very much. Thanks for watching.